Well, as more people get the COVID vaccine, you might be wondering, is it safe to see someone in person if they've gotten the vaccine and you have not? Or is it safe to gather family and friends together and come together in person? A lot of questions these days. And we are joined by Dr. Matt Anderson from UW Health. Thank you so much for being with us, Dr. Anderson.
Yeah, thanks for having me.
Yeah. Now, one big question. I haven't gotten the vaccination. My friend has gotten the vaccination. Can I see them safely or should I wait? What should I do?
Yeah, I think it's really a risk-benefit conversation with that. We all would like a simple yes or no, but really the reality is your friend is protected from both COVID-19 infection and from severe illness from COVID-19 pretty well, but we don't know that they couldn't potentially be exposed and then transmit that to you, and then you could become infected and have risk of complications or transmit to others. So it really is a risk-benefit conversation to determine whether or not you and your friend want to get together.
So it sounds like, Dr. Anderson, people still need to be vigilant about masks and social distancing, even if one of the individuals has gotten that vaccination.
Absolutely. That is a way to keep those interactions lower risk. We know that there's a lot of isolation feelings, mental health issues that have come with the pandemic. But if you're going to get together, it's definitely lower risk to follow those guidelines for sure.
Doctor, how long does it take for the vaccination to actually kick in after a person has gotten it? Do we know that at all right now?
Yeah, so if you think about the Moderna and Pfizer vaccines, after that first dose, a week later, you're getting about 50% effectiveness. A week or more after the second dose is when you get to that 95%. So really be thoughtful about waiting until that time period to consider getting together.
Yeah, that makes sense. Do we know how long these vaccinations will last before maybe a person has to get another shot, or is that still a big question mark as well, doctor?
Still being looked at and to be understood. So we'll be following that. But right now, we don't know if we're going to need boosters or other adjustments, but hopefully we'll know more about that in the coming months.
And again, what percentage of the population actually needs to get these vaccinations before everybody is okay or we can go somewhat back to normal?
I think part of it's going to depend upon the level of community spread. So that'll certainly be something to be monitored. When you think about herd immunity and getting to sort of an ideal state, you're talking about 75% of the population plus being vaccinated. So we're still a ways off from that at this time.
Yeah, I guess that's for sure, but at least we have the vaccination. Dr. Matt Anderson from UW Health, we appreciate you being with us this afternoon and giving us your insight. Thank you very much, sir.
Thanks for having me.